birth control is not the only answer for endo or PCOS. Today, let's explore options your doctor might not have mentioned. It's kind of interesting, isn't it? So many people dealing with endometriosis or PCOS, it often feels like the conversation just starts and stops with hormonal birth control.
Right. And look, it can help some people. Things like irregular cycles, heavy bleeding, painful cramps.
Yeah.
Birth control can definitely make a difference there sometimes.
Sure, but it's not the whole story. We've been looking into this, and it's clear it's not always effective. Or the side effects are just too much.
Exactly. Or some people just, well, they don't want to take hormones. Or maybe they can't for other health reasons.
So our goal today is really to dig into some of these other strategies, non-hormonal ones that actually have some science behind them. We want to give you information so you can have, better, more empowered talks with your doctor.
And it's so valid for people to feel frustrated, really frustrated, when birth control seems like the automatic, maybe even the only suggestion. Because looking at the research, while hormones might tackle certain symptoms, they don't always get to the root causes or the complexities of endo and PCOS.
Right. Which leaves people feeling like, well, like their overall health isn't really being looked at.
Exactly.
And it brings up those big questions, doesn't it? Like, is this it? Is this the only way?
What if I can't take hormones or just don't want to?
Why hasn't anyone talked about alternatives?
These are really important questions.
And based on what we've seen, there's actually a growing amount of evidence that supports, a broader approach.
Absolutely. So let's shift gears. Let's talk about some of these other strategies. Non-hormonal approaches, things with some solid evidence that could really make a difference in managing symptoms day to day.
Okay.
And it's important to say these aren't necessarily like cures, but they are tools, a range of tools that might lead to feeling genuinely better.
Okay, so based on the research we looked at, one thing that really stands out is anti-inflammatory nutrition. What's the deal there?
Well, it's pretty fascinating. There's a really clear link between inflammation and both conditions, endo and PCOS. And what you eat can either sort of fuel that inflammation or help dampen it down.
Okay.
So the research points towards cutting back on things like ultra-processed foods, lots of added sugars. Those are known inflammation promoters.
Right.
And instead, increasing foods rich in omega-3s, fatty fish, flax seeds, also leafy greens, lots of antioxidants there, and high-fiber foods.
So it helps the body fight inflammation naturally.
Pretty much. It's about supporting the body's own anti-inflammatory pathways, which often seem to be working overtime in these conditions.
That makes a lot of sense, using food to help your body regulate itself. Now, what about something maybe less talked about? Physical therapy.
Yes. This is such a crucial piece for so many people, but often overlooked. We're talking about physical therapists who specialize in the pelvic floor.
Okay, what do they do?
They're experts in all the muscles and tissues around the pelvis. They use things like targeted exercises, sometimes hands-on therapy. It can make a huge difference because many people with endo and PCOS have chronic pelvic pain or pain during intercourse, even bladder or bowel problems, often because those pelvic floor muscles are tight or not functioning right.
So it addresses the physical tightness and pain.
Exactly. It targets those specific musculoskeletal issues, providing relief that hormonal treatments just don't usually touch.
That's really insightful. It shows how these conditions affect more than just the organs,
Totally.
What about complementary therapies like acupuncture? We hear about that sometimes.
Yeah, and the research there is actually quite interesting. Several studies suggest acupuncture might help reduce pelvic pain.
Wow.
Well, the thinking is it might influence nerve signals and maybe even blood flow in the pelvic area. There's also some evidence pointing towards it potentially helping with cycle regularity and maybe even lowering some inflammation markers.
Oh.
Now, individual results can vary, of course, but the research is growing, suggesting it can be a valuable part of the plan for some people.
So it's not just like tradition. There's actual science looking into how it might help with pain and symptoms.
Right.
Okay, let's switch to supplements. This feels like a tricky area. Lots of people are looking, but it's confusing.
It definitely can be. And the first thing, always, is talk to your doctor before starting anything new. Super important.
Definitely.
But that said, for PCOS, one supplement that keeps coming up in research is inositol.
Inositol.
Yeah. It seems to play a role in improving insulin sensitivity. That's how well your body uses insulin, which is often an issue in PCOS.
Yeah.
And it might also help support ovulation.
Okay, that's specific to PCOS then.
Yeah.
What about more general things like for pain?
Well, for cramps and general muscle tension, magnesium is one that some people find helps.
Magnesium. Okay, so Specific things like inositol for PCOS, magnesium, maybe for cramps,
Yeah.
always with the doctor's okay first. Now, kind of shifting gears a bit, but still important. Lifestyle stuff, like sleep, stress.
Oh, absolutely. You can't overlook these.
Mm.
Lifestyle interventions might seem less direct than, say, a pill, but their impact over time is huge.
How so?
Things like prioritizing good sleep, finding gentle movement that actually feels good for your body,
Mm-hmm.
and actively managing stress. These things significantly influence your hormones, chronic inflammation levels, even how sensitive you are to pain.
It really adds up.
It really does. They aren't quick fixes,
Uh,
but they are fundamental for feeling better long term.
it really paints a picture of needing like a whole toolkit, right? Not just relying on one thing like hormones.
Exactly.
And like we said, these are supportive tools. They work with medical care, not instead of it.
Right. Empowering you to be more involved.
So for you listening right now, maybe just take a second. Think about what we've talked about. Are there maybe one or two non-hormonal things that kind of sparked your interest, something you'd want to explore?
You deserve to have choices that fit you.
Yeah.
Now, the next step, and this is key, is how do you actually talk about this with your doctor or your care team? It can feel a bit intimidating sometimes, understandably.
Yeah, definitely.
But just remember, you're the expert on your own body. You're a key advocate.
So what are some good ways to start that conversation, like specific questions?
Yeah, having some questions ready can help. You could try something like, based on my symptoms, can we discuss some non-hormonal strategies that might help me feel better?
Okay, that's direct.
Or is there a way we could combine lifestyle changes, maybe some of these therapies, with the medical treatment you're suggesting?
I like that, combining things.
Or even, would it be okay if I tried some of these non-hormonal approaches first while we monitor how I'm doing?
Those are great. They feel collaborative, not demanding.
Exactly.
But what if? What if the doctor seems dismissive or just pushes birth control again? What advice do you have then?
That's tough.
Yeah.
But it's so important to remember. If a provider dismisses your questions or makes you feel like hormones are the only option, that is not your fault. It doesn't reflect on you.
Right.
You absolutely have the right to advocate for care that looks at the whole picture, that considers different strategies.
You're not just a diagnosis.
Precisely. You're a whole person with your own needs, your own preferences. You know your body best. And honestly, don't hesitate to get a second opinion if you feel like you're not being heard.
That's really important advice. Okay, and to help with all of this, tracking things, understanding your body, let's talk about the March Health app.
Yeah, the March Health app can be a really helpful tool here. It's designed specifically to support you. You can track all sorts of symptoms, pain, digestion, mood, energy levels, whatever is relevant for you.
Mm-hmm.
And crucially, you can also track the strategies you're trying out. Like, did changing your diet help? Did that supplement make a difference?
So you can see patterns.
Exactly. The app shows you this data in clear visual trends over time, which is something you can then easily share with your doctor. Gives them a much better sort of real-world picture of what's going on with you and what's helping.
That sounds incredibly useful, gaining those personalized insights into what actually works for your body.
Yeah, it helps you make more informed decisions about your care.
It's all about empowerment, really.
So wrapping things up, the main point we wanted to get across today is that, yes, birth control is an option, but it is absolutely not the only option for managing endometriosis and PCOS.
Right. There's this whole range of non-hormonal strategies backed by evidence that can offer real support.
Nutrition, pelvic floor PT, acupuncture, certain supplements, lifestyle changes.
It's about finding what combination works for you.
And the key takeaway really is that your care should be tailored to you, your individual needs, your values, what actually makes you feel better.
It shouldn't just be limited to one prescription pad solution.
No.
And hey, if this deep dive resonated with you, if it sparked some ideas, maybe share it. Share it with someone else who might be navigating endo or PCOS and looking for more options.
Yeah, these conversations are so important. Opening them up is powerful.
Definitely.
So until next time, keep asking those questions. Keep listening really closely to your body. It tells you a lot. And know that March Health is here to support you.
Yeah, absolutely. And if you want to dig into the science yourself, we really recommend checking out the NIH review on non-hormonal management of endometriosis and PCOS. We've put a link right in the show notes for you. Makes it easy to find.
Great resource.